You think launch? Think we're ready to go? So let's call to order. Welcome. I think we've been chatting ourselves up in the proper way. And I think we all know one another. Arthur, Big Island's in the house. All right.
Oh, gosh, yes.
Woo! It's not raining yet. You'll be the last one to get the rain if Oahu's getting it first. You will. Okay,
Doesn't
so
matter.
in the interest of dotting the i's and crossing the t's, I'm going to read this really important statement. Any interested person may submit testimony in writing to the board on any agenda item by regular mail, email, or fax. An individual or representative wishing to testify in person should register prior to the start of the meeting. Testimony must be related to an item that's on the agenda, and such a person shall be required to identify the agenda item to be addressed by the testimony. Submit testimony by one of the following methods: emails to this email address, or fax to that number, or mail to the Hawaii State Center for Nursing Advisory Board at the McCarthy Hall address on campus. Each individual is allotted 5 minutes or any amount of time otherwise designated by the chairperson to provide testimony to the board. So here's everyone. Bonnie's on the mainland too. Laura, we talked about, and Doreen. I don't know the exact issues, but everyone else is here.
It looks like, is Julio with us?
No, I don't think so.
Okay.
Is Julio still on the board?
this? Oh yeah, there he is. There he is. Yeah.
Oh, is he here? Oh,
No,
okay, he's
I
on the
see his
list.
name. Yeah. Okay, so I think we can launch off into the agenda. Did I read this too? Oh yeah, Maya. If you can't provide testimony now, you'll be allowed to when the items are called. For internet and phone access, identify yourself and your organization. Testifiers will be limited to 5 minutes. Written testimonies are public documents. So if you define what SLASI means in writing, it will be a public document. Any testimony that's submitted orally in writing, electronically, or in person for use in the public meeting process is public information. It will be posted on the board's website. Thank you. Okay, so we'll just, since this is bright yellow, I'll just make a motion right now to postpone the policy update until the next meeting. Can I have a second for that?
Second.
Thank you. So then we'll go to Dr. Oliveira for an update on the workforce survey, which is open.
Technically, you need a vote on a motion, Anne.
Oh, we do? Thank you.
Yeah.
So all in favor of postponing Laura's report, say aye.
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 Okay, all ayes and no ears, it passes.
Outstanding. Okay, I'll give my update. Yay. Okay, so workforce survey updates, and you are completely correct. It's in the field, it's open. Woohoo! So I didn't prepare slides. I figured I would just talk to you guys. I'd rather see your faces. So lots of updates about the supply survey. So I'll start with the fielding update. So I have updates related to content and I have updates related to fielding. I will start with the fielding update. So if you have not already renewed your license, which I know Rose did, I got a text message from her last night.
I did.
And it, yeah.
And I surveyed, of course.
Of course you did. So license renewals opened yesterday. Laura and I were able to meet with Leanne Tashima, who I'm sure by now, as you all know, is the executive officer of the Board of Nursing, along with, I don't know exactly what her job is, but Shar Oshiro, she deals with, like, she tests the environment, the license renewal environment in my PVL. So we had a meeting with them last week and we were so excited. Like, I left that meeting feeling very optimistic. They went ahead and did all of the things that we asked them to do after the snafu in 2021. So Rose actually texted me last night. She's like, the survey link is everywhere, and I'm not mad about it. It is in there. If you already have a license attached to your PVL, your MyPVL account, it will automatically appear in the MyPVL portal. It's in there at the start of the license renewal application. It automatically opens when you click OK after you make your payment. The link is on the payment receipt that you get by email when you're done. So there is zero chance that we will have a terrible response rate because people couldn't access the survey. That is not a thing. In addition to that, per the conversation we had at a previous advisory board meeting, and then a subsequent conversation I had with Arthur at Leadership in Action, we also went about expanding fielding to separate it from the license renewal process. So Leanne Hussey has made a survey flyer for me. And we went about this by tapping into the Healthcare Association of Hawaii and the Office of Healthcare Assurance. Between those two organizations, we cover the majority of nursing employer organizations in the state. So we asked them to, on our behalf, send the flyer along with a request for employers to please promote the survey in their organizations and distribute the flyer to their nurses electronically. We also made available to them that we would print copies. If you want printed copies, we'll send them to you in the mail so you can hang them up at nurses' stations and bathrooms and wherever it is that nurses hang out in your organization. So I haven't received confirmation yet from Jana Hoshide or Keith Ridley that that email has actually been distributed, but I'm going to check on them. I'm actually going on vacation starting on Thursday. I'll be back in the office on Wednesday. So if I haven't seen confirmation from them come through, I'll follow up. Also at that point, we will tap into the CNOs to help distribute that instead. So the reason we went with the organizational level, excuse me, was because we already have great relationships with people who are like sitting in this virtual room. I could ask you guys to distribute a flyer for me. What we really wanted to do by going with HH and OCA was to help us tap into the organizations that we don't have good relationships with and that we don't have a strong contact with. So really what we're trying to do is improve overall participation in the underrepresented subsets of the workforce, long-term care, the kind of critical access hospitals that don't show up to our meetings and things like that. So as a secondary tier effort, I will leverage the CNO meeting that we have on a regular basis and ask them to distribute the flyer to the nurses that way. The flyer does include a QR code. It also refers to the Nursing Workforce Supply Survey as the Hawaii Nursing Survey. So it's a little more accessible. We created a vague statement on the flyer about like, oh, fill out the survey if you want to be counted as a nurse. It doesn't mean anything. We're just kind of hoping it, like, out of an abundance of caution, nurses will be like, wait, I'm not a nurse if I don't do the survey. So they do it. So I'm not above like a little bit of trickery. I'm not going to lie. So, and I love the Arthur emphatic nod of approval on that. So we're hoping that works. We also added a bullet point there that completing the survey will help your employers create a better work environment. So I'll get more to that when we talk about the content updates to the survey. So the survey also does have a QR code on it. So a nurse can just like walk by, bookmark that thing. And, when they're sitting in their room at the bedroom trying to fall asleep because they're worried about going to work the next day, maybe they'll fill out the survey, but you don't have to be in the middle of relicensing to do it. So I'm feeling very optimistic that we're going to get a gigantically huge response rate this year that hopefully exceeds anything that we've had so far. I will say optimistically that according to our metrics in SurveyMonkey right now, we have almost 50% of the total responses we got in 2021 as of today, which means in 2 days of nurse relicensing, I've gotten 50% of last year's total responses. So whatever we do beyond that, I'm not mad. So yay. So I want to thank everybody.
Crush it.
Crush it. We're going to crush it. I'm going to be able to put maps back in my report, y'all. You have no idea how stoked I am about that. I'm out of control about it. So we sent our deep appreciation to PVL for their enormous assistance in making sure that that link was available. And I want to express my gratitude to this group in particular for your feedback, for your insight, your suggestions. I took pretty much all of them, I think. So we're really hoping to see a successful survey run this year. So thank you for your support on that. So that's the fielding update. Any questions? Cool. I'll move on to the content update then. I just wanted to make you guys aware of a couple of critical changes that we've made for strategic reasons on the survey. In general, it is not my inclination to change the survey very much from year to year. It disrupts trending, right? If we change the way we ask questions and the survey is materially different from fielding period to fielding period, and it makes it difficult to do comparisons. So I try to limit what we try to change. That said, last year, we added the well-being module, which was new. I dropped all the COVID-related questions because I think there's some general consensus at this point that well-being is independent of COVID. And we can, like, COVID has an influence on that, but I think we need to start talking about well-being more generally. So what we did is we changed the way we asked some of those questions. So we've got a frequency component added to a lot of the things that can happen on more than one occasion. So we asked in general terms, like, in the last year, have you thought about leaving the profession of nursing? That's like a one-time thing that we might expect you to do. But for other things that can happen with greater frequency, have you interacted with a friend at work? Have you been the subject of abuse or incivility by a coworker or superior? Have you experienced abuse by a patient or a visitor? Those are the sorts of things. One of the critical additions to that is we added a question related to how much time they're spending working. So we asked the question, how many times have you been asked or expected by your employer to work more hours in a shift or more shifts in a week than you feel is safe? And the reason I asked that question was to specifically get at that mandatory overtime in general conversation. If nurses are reporting the perception, independent of that word mandatory overtime, if nurses start reporting to us that they're having expectations of their employers that they're working to a degree that's unsafe, that is important for us to know. So I think that there may be policy implications for having that piece of data. We'll see how it turns out. Not sure, but I thought it was important for us to ask. Similarly related to potential policy implications, we are changing up the way we're asking some questions about out-of-state nurses. A question has always been on the survey to ask nurses, what other jurisdictions are you licensed in? We added a question, I think, in 2021 about, do you actively practice in these other jurisdictions? This year, I expanded that question to ask them specifically how they practice. There's, I think, going to be implications for this, that it is very likely that the concurrent resolution currently moving through the legislature that's going to task the Center for Nursing to convene a working group that examines the implications and feasibility of implementing the Nurse Licensure Compact is going to pass. So I think that understanding what the prospective workforce out of state looks like for us, what are they doing? Are you living in, I don't know, Arizona and you provide telehealth? There's some indication there that we're probably not going to be able to recruit that nurse into Hawaii for like travel nursing or as an out-of-state recruit. So I think we just have there's a dearth of information right now about what it is that nurses who are licensed in the state but living out of state are actually doing. We do get some information about that from the regular questions on the workforce supply survey, but I'd really like to know how they're interacting with the other jurisdictions that they're licensed in to see whether or not they're viable recruits to our workforce. So we're hoping, I haven't quite solidified what that report will, or how those data will interact with the working group yet, but I felt like it was important for us to have the potential to have answers to those questions. So that's the other thing I added. I didn't even run that one by Laura, I just did it. And the last one I think is a really important addition is, for the first time since I've had anything to do with the workforce supply survey, I put an open-ended question on the survey. I am already stressed out at the analysis of those data, but this came about as a result of two separate conversations I had, I want to say, within a week of each other, first with Rose and then with Amy Thomas at HPH. And the intention for the question was, great that we're tracking well-being and we have metrics about that, but what am I supposed to do? What is the action that we can take to actually improve what is happening in our organizations to the betterment of our workforce, and in particular, the retention of our workforce? And I didn't know how to answer a good question. We don't have enough data to create the foundation for that. We thought about it, right? We could change shift durations and whatever, but then I'm constraining what nurses want, and that doesn't help anybody. So I put an open-ended question on the survey and I asked, what is the one thing you would like to see your employer do that would help you want to stay at the organization? What I'm hoping we're going to get from that is actual tangible things that we can report back to employers to say, hey, yo, this is what the workforce is looking for. So if they suddenly say, I want 4-hour shifts, I only want to work a 4-hour shift ever, but I want to work 40 hours a week, when you need to add 3 days to the week. So good luck with that. But still, we'll have some very specific and tangible recommendations, I think, for employers pretty much for the first time, I think, based on the data from this survey. So, you know, I have this, if you've heard me talk enough times, you'll hear me say repeatedly that I don't like to collect data for no reason. But the converse of that, of course, is that if we need data for something, we ought to be collecting it. So if we need, you know, actionable data to make interventions that help the workforce, then I need to be asking better questions on the survey. So that was the intention for any additions that we made. So hopefully we get some juicy, good, big, important, interesting data bits out of the survey this year. So I'm really stoked about it. Do you guys have any questions for me about changes to the supply survey for this year?
It was very easy to do.
Oh, good. I'm glad it wasn't horrid.
Oh, so
Don't
you
tell me
did
if it
two
was.
already, Anne. You're done?
Yeah. Yeah, it was no problem. As a matter of fact, I went in there on Friday and I couldn't get my license yet, but the survey was open. So I did the survey before I renewed my license.
Yes, apparently a lot of people did, and that initially stressed me out. Like, apparently they put the survey link up and it was appearing in my PVL, and about a week before relicensing was supposed to start, I see responses in the survey and I'm like, someone hacked my survey, I've got bots, I'm infected. I freaked out. We changed the link. PVL changed the link. I don't actually think they're invalid responses. I think that PVL just made the link available and people were really just excited about renewing their license and they saw the survey and they took it. So I'm not mad about that. I am going to do some data cleaning to make sure that the data, I went to a research symposium last week, Friday. One of the presentations was on hacked botted surveys from SurveyMonkey. And so there's this, like, you got to pay attention to the consistency and coherence of the data. So that is going to be, I'm going to be especially vigilant about that this year, just because I had some small suspicion that the survey might have gotten hacked. But I think that the data actually reflect that people were just like, oh, survey's here, I'm gonna do it. So I'm not mad about it. So I actually think that we have good, valid data. So things are
That
looking.
was me. You better count mine, man.
I will count you, Anne. I promise. I promise. So that's what's up. Any questions? Anybody else? That's the report from the nerd workforce researcher. Ta-da!
We love
You made
your
it sound very
nerd.
exciting, Carrie.
Good, it is exciting. I'm so excited. Like I don't remember the last time I was this excited. I was probably going to Disneyland. Nope. I'm more excited about this than ever going to Disneyland. So
We should have a little ticker on the website.
how number surveys completed.
Yes.
If I knew
yes.
anything about programming a widget on a website, because I have a spreadsheet that I track. It's Laura's favorite spreadsheet that I've ever created at my time at the Center for Nursing, but I update the counts daily. And so she checks it almost as compulsively as I do. So I am keeping track of that. So we have it. So that's, if you guys have any questions at any point, let me know. If you guys, if Rose and Arthur, if you want to do me a favor, and like, if you happen to see that flyer come through your organizations at some point, just be like, hey, saw your flyer, that we all know it's kind of like out there in the universe.
Who's
So
it coming from again?
that I don't know. So you're probably going to get it
Oh,
from
okay.
HAH. So I don't know who at HAH is going to
Okay.
send it, and I don't know who's going to get it at your organization.
All
So
right.
I
Yeah, I
don't.
didn't see it yet.
Okay, I didn't get confirmation yet from Jana that it got distributed yet, so I'm not surprised to hear that. So if by the middle of next week you haven't seen it in your organization at all, if you will just send me an email and be like, hey, yo, I ain't seen this yet, I will follow up with the respective powers that be. Mahalo in advance for that. All right, Anne, back to you.
All right, very cool. So on the heels of that is really the heart of the discussion today. Laura sent those articles out, and really it's some very comprehensive data looking at the state of nurses' view of their job and their feeling of wellness in their job. And I think wellness has been defined by all of us as a priority, as a strategic priority that would help recruitment and retention. So I don't know how much homework you got to do perusing through those articles, but they had good abstracts about it. Here's Laura's comment: relevant, specific answers to nursing environment questions. 0.2 of total responses were from nurses in Hawaii. So Carrie's workforce survey is going to be really important for us, but it's a nice set of findings we can use now we can compare ourselves to once we get our specific data, and thankful for ANA and that we have this source that will support our research. So I definitely saw the similarities. Did you guys come away with any high level sense from running through those articles? Anything that stuck out or any themes that you saw? Yeah, so Bree has them all here. Do you want just 5 minutes to look through them? You want to just take 5
Yeah.
minutes?
Mhm.
If you have your agenda and keep scrolling down far enough, they're all there.
Yeah.
And they have nice headers on them, so it's kind of easy to just zip through. So it's 56. Why don't we just wait till 6 o'clock or 6:01 and give you just a couple minutes to whip through these?
I'm gonna step away briefly. There's a package outside my front door that's getting soggy, so I'm gonna go get it.
All right, did you get a couple tidbits? I mean, if you really sit down and read them all, there's a lot of common themes. So starting with Carrie's comment in the chat. She says the studies, there's a trend that younger or less experienced nurses report more negative responses related to the burnout questions, however they measured them. And that is a worry.
I'm gonna have to agree with that. You know, from what I'm seeing, the young nurses, what's the word I'm looking for? They're a lot more privileged. And I don't know if that's the right word, but you know, you come into new higher orientation and they're already asking, when can I take vacation? It's like, this is your first week of work and you're asking for vacation. So I think the work ethic is slightly different from my age bracket. So that's a big difference from what I've seen. And also, I did a deep dive. I went back 5 years in all my critical care areas and why people left. And there's no common theme there. And not one of them was burnout. I mean, they left because they went back to school, further education. They left because they want to be a full-time mom. They left because their parents are aging and dying. They left because multiple reasons, but there's no one that said burnout or similar to burnout. So, I mean, I like these articles. I mean, and this is good research. But from my personal research, I'm gonna have to disagree with some of the stuff in this articles.
Arthur, I'm curious, are you, if you're seeing a sort of a change in the work ethic of younger nurses, would you forecast that you might see a future trend of departures from the workforce related to burnout?
Yes, and not necessarily burnout. I think the work-life balance is
Yes.
the common word that they're throwing it out right now. I mean, my new hires are throwing out the work-life balance. And they work 3 days a week. It's like, okay, you got 4 days off. I mean, it's just, it's not the right answer, but I mean,
Yep.
yes, I can foresee the dozens and dozens of NRPs I'm hiring right now that they may be leaving in 2 to 3 years.
Your organization or the workforce?
My organization and my workforce. And I think that might trend across the nation too.
Yeah,
I think so.
that'd be my
That's
guess.
I
correct.
hope not, but I think it might.
So they'll be job hopping. They won't
Yeah.
be leaving nursing.
Yeah, I guess, yeah. You know, I just, there's a handful of good nurses I just left because want to be travelers. I mean, that's, I don't know if they're chasing the money or the travel or the experience of being away, but they want to be traveler nurses. I mean, that's what they want.
Are these local kids, Arthur, who left to be
Yeah, I've
travelers?
lost a few local kids that want to, it might be they're way out of their mom and dad's house, but I lost a few of them, good ones.
Mm.
And some of them come back, you know, they travel, like some of them traveled like 1-2 years and they came back.
Yeah, well, that is, I couldn't find the discussion about the travel nurses in these articles. I must have whipped over it too much, but there's a report that they have a higher rate of burnout and feeling of well-being than the regular staff nurses do. So, you know, that the travelers have been, from an organizational point of view, kind of a stopgap for staffing emergencies.
Yes.
So if that pool was to dry up, that would put a lot more pressure on every local organization.
For me, a concern is that if the newly graduated nurses are leaving the profession or even their workplace within 2 years, right? I mean, we can continue to educate and provide supply, but if the retention is not happening, I mean, it's like a faucet that just continues to.
Like a hole in your boat, you know, you're floating
Right.
around, you're like trying to bail the water out, but it doesn't matter.
Yeah.
Yeah, that
So
scares me too, Glenn.
yeah, internally, I'm saying to the faculty and the nursing academic leaders that we need to build into our curriculum, grit, commitment, resilience. It seems as if when they encounter something challenging, they just like go. I even see that with even my friends, children who's entering the workforce. Every time they're challenged with something, they just leave. They don't want to work harder. Oh, I don't want to do that. I'm gonna go to the next job.
Right.
So
I agree. Yes.
there's
And they are reporting that they're the ones who are reporting they're the most stressed out. So it may be some of it that they don't have the work ethic, but they also may be needing what you're talking about, Clem, a little very intentional training
Mhm,
on dealing with conflict and challenge
mhm,
in a professional environment.
mhm,
And one of the other things that the demographic surveys highlighted was, a lot of 200,000 older nurses left, but more than that, younger nurses arrived, and those younger nurses are also more diverse. So the assumptions that they're bringing into the workplace are not only generational, but they're also cultural.
exactly. Yeah. Mhm,
So that's hard. And there was another interesting note that the view from Arthur's chair and the view from the bedside was different on the same problems in the same place. So
mm,
somehow, there needs to be, how do you mind meld that?
yeah.
What are the skills those young, diverse nurses need to feel, to have the coping skills to really see the future of nursing come on their
Right.
prowess?
And I wonder if it's because people are entering nursing for, the high pay, high salary, and not really because they want to be nurses, right? Because I think, like, yeah, our younger son said, "Oh, I think I'm gonna go back. I'm gonna go into nursing instead." And I said, "I thought you're gonna go into IT. Why are you going to go into nursing?" "Because the money's good." And I said, "Well, that's not the reason why you should choose a career. You should choose the career because it's something that that would give you that would be of value to you, would be enriching your life, and so on and so forth." But I wonder if it's the lack of commitment is attached to
Right, right.
the lack. I mean, if they're going in it for the money, and the money is not good enough to keep them there. Because there's another place that's willing to pay higher, right?
That's a good point because, when I did it, we do our own internal surveys. No one's complaining about the money. They're all getting paid enough. I mean, in fact, they don't want to pull an extra shift or overtime or take call because they're comfortable. So that's what I'm finding too.
Mhm.
In the unit where I do my clinical, it's a neuro tele unit. And they were a warm unit for lots during COVID. And they are very verbal. They're probably in their young 30s is the most of them. And they're very verbal about their displeasure in a lot of areas. But one of them told me, we all sit around having drinks and calculate. There's no better place where we can earn this much money anywhere in Maui. This is our best job for our families, for educating our kids, for having our houses, for going to Disneyland. So we're just staying there, but they're not happy. So, you know, how that affects the environment and the patient care is a real thing.
Right, right.
Even though they're not going to leave that job, there is clearly work to be done. You know, organizationally. In Maui, they think nobody listens, that the admin doesn't listen to them even one word they say. So, and in these surveys bear that out. They feel that one, 5 questions about the organization on a scale of 1 to 5. Do you think if you did the best job in the world, you would be noticed? Do they care? It was below 3, all of them.
Mm.
Gary.
And you know, and this is Gloria, and I do agree. Like
Sorry.
one of the things Clem mentioned about the new graduates entering as an employer, you know, what types of environments are we setting up, or what types of environments do we have there, especially now coming out of this pandemic and having to kind of adjust practice to modify some of the standards. Is there confusion? Because I want to say that, and I agree with Arthur, maybe for lack of better words, privilege, but I'm also noticing more of a black and white scenario rather than critical thinking. And so when employers are not able to be black and white, when our profession really constitutes that we be critical thinkers, it has frustrated, especially in public health, some of our new nurses, heck, even some of our senior nurses who are black and white or need that black and white, that critical thinking really stresses them out. Just tell me what I need to do, rather than looking at a systems issue or a large problem, or coming from a larger perspective of what do nurses do in the field. And so we're running into, at least in my experience, is the black and white. And if the black and white is not apparent up front and center, it's causing a lot of stress and frustration. I don't know how to teach someone to critically think. You know, they come with it or they don't come. And when they come with it, they seem to thrive and do really well. But when the critical thinking is not as strong as we'd like it to be, we notice that there is more stress and frustration, or at least I do, more stress and frustration there. So just wanted to add to conversation.
Yeah,
Makes sense.
yeah, those are great points, Gloria. Yeah, because they're black and white, they're very, very rigid, right? Also.
And you can't have a decision-making algorithm for everything, right? Like you can't fathom every possible scenario. That's what they're looking for. Yeah. Is that if this, then I decide this, if that, then I decide that. You'd have to envision every single scenario to create one of those for every possible thing. That's not the point. Like you got to use my judgment. Linda, I saw your camera come on. I don't know if you had anything to say, because I have questions for you guys and I don't want to occupy time. But Linda, I saw your camera come on. I didn't know if you had anything to say.
Camera came on?
Huh?
My camera came on?
Oh, no, I mean, it was on, but you unmuted yourself. Like you looked like you were going to say something. I was reading nonverbals.
Well, I'm taking this all in. You know, and when Arthur was talking about the reasons why people left from his workplace, when he looked back on them, you know, you can look at that in a little bit different way, in that it sounds like all of those reasons had to do with work-life balance. And that's not new, but it's also generational, that younger nurses are way more willing to walk away from a career or a position because of lack of work-life balance than older nurses ever were. And we're talking about making sacrifices and being dedicated, and being resilient and meeting challenges, but also there's a great willingness in younger nurses to balance their lives that we never we're aware of for ourselves. I think that's a big shift.
I
Yeah.
agree with that, yes,
Yeah.
totally.
Yeah, yeah. I think it does have curriculum implications, right? Yeah, the work balance, and it's not only in nursing, you know, I have a sister who's owner operator for McDonald's in Maui and Oahu. And she has to go to other places in the world to recruit. She goes to South America, Eastern Europe, Southeast Asia to recruit workers. I mean, she's offering up to $15 an hour. When I worked at McDonald's, I got paid $2.60 and I was happy. But they're getting paid $15 and they're not happy. And I'm like, wow. So, but then what happened is when she brings in these workers from other parts of the world, they really up the performance. And people comment on that, they notice it. So, and I think it changes the behavior for a time. I don't know if you can do that in nursing, but you know, it's so true, the work. And like when we were growing up, when I was growing up, if someone offered me a promotion, I'd grab it, but they don't want it. It's too much responsibility. It doesn't
Yes.
go with my, you know, the work and personal balance, right? It's hard to find anyone willing to take on leadership positions.
Yeah, because I don't care how many theories of leadership there are. There's always a bit of servant in it. I mean, you are helping your organization. You are greasing the wheels for everybody to do better.
Mhm.
And you know, that's outside of just a job description. That's what the leadership really is, to help people do well. So I know, I can see why, but I think that they don't think they have the skills, which of course they do, but how do you connect it with the things that motivate them? If work-life balance motivates them, how do you connect that with it?
Mm. Mm.
You know, and there's some comments in the chat about, you were kind of referring to it, Clem. It has curricular implications about teaching clinical judgment, critical thinking. And is there time with next gen coming up? Well, next gen is all about clinical judgment. That is the
Right.
whole point. It's actually driving us exactly where we should go.
Mhm.
So I think that new nurses are certainly going to get their teeth cut on that,
Mhm.
thinking that it's not black and white,
Mhm.
that you have to be client-centered and individually assess what's necessary and
Yeah.
individually interpret all that data to predict what could happen.
Mhm.
So, but, you know, you can't get experience in a credit. You actually got to work. But it
Well,
is,
and that's the thing too. I think with that whole scenario of, you know, do you work, if I can work 4 hours a day, and that's kind of what I'm seeing with the next generation is working of just an 8-hour workday is challenging. It I don't know if it's related to stamina. I don't know what it is, but the 8-hour workday seems to be challenging. And as employer, when you have to go around and tell them, hey guys, break's kind of done, let's return and let's get started working again, it's frowned upon that you actually got to do your job when you're at work. And I'm like, oh, okay, you know, let's sit down and have a conversation. And so I'm not sure, you know, where that came from or how that's come about,
Mhm.
but working 8 hours is hard. I'm noticing for some people.
Mhm.
And so, and I don't know if those are the reasons why they leave. But workspace wellness is, it's as if we have to tend to their wellness, rather it being something that they control personally and cope with it and manage that balance for work. But it's almost as if the employer is expected in more ways, more stress is put on the employer to do it rather than the individual, is what I'm seeing too. And so I'm like, that's kind of hard. You get paid to work for 8 hours. I gotta ensure, especially if it's taxpayer money, right, that you're working those 8 hours. So how do you balance that? And it's like, you're here to do a job, but there's a lot of wellness that needs to come out from the employer themselves for employees to take, advantage of. And then we have to allow time for them to do that. And so, systems issues, systems wise, there is a lot more expectation from the systems to be able to do more wellness at work than actual work, or at least that's the impression I'm getting.
So is it just recently, Gloria, that you noticed post-pandemic, or was it in existence pre-pandemic even?
Pre-pandemic, there was a different, the concept of work space, or even just wellness and balance, was very different from what I was seeing. Team building was something that people wanted to do, and that we could foster that team, and that was one way to take care of wellness. Having those alternatives and just simply having a team that says we have your back was one of the, especially in public health nursing, just hearing those words, don't worry, we have your back, that was people took that as wellness, that I'm in a place where people have my back. Should something happen to me, someone will be there to cover me. Now they're still that way, just a little, but they're trying to rebuild their teams right now. Pandemic just kind of messed with everything. So they're trying to rebuild their teams and figure out, through everything with working all the long hours and stuff like that, it has allowed them to do some reflection and say, you know what, we cannot work those long hours that way again. And because I did, I need some time, I need some downtime. And so one of the things that we do especially is we look at the vacation leaves, and we're telling them, hey, you haven't taken vacation for this many months. You're in a use it or lose it stage, or it's been more than 6 months, 8 months, it's time you need to take vacation. And so we're having those conversations with the individuals to make sure that they take ownership of taking care of themselves and not put it only onto us. You have the leave, take the leave. We've made it a part of our public health nursing branch strategic plan for wellness, and so we're putting it up front, but our expectations have not changed when it comes to the work. You're still expected to do the work. So it's kind of people retired and left because they could. And when we're going through it all during the pandemic, and I asked, if you're willing to share, just interested in knowing why you're retiring at this point in time, and they're like, you know what, I've seen it all, I've done it all. I'm okay to leave at this point in time, and I kind of envied them. But yeah, it wasn't because they were stressed out at work. It was because I've seen it all, I've done it all, I'm ready to retire, or I want to look at a different opportunity. But now with the people who apply for our position, they kind of, we hear it and they're upfront about it, and it's like, well, I want to see, you know, how this works. If it doesn't work, then, you know, I'll find something else, you know, but just kind of seeing if this is where I belong. So I was like, why is it, in my mind, it's like, why is it taking this generation just a little bit longer to figure out what they want in life? I don't know.
Mhm. Complex, yeah.
Well, it seems I can hear you guys talking about the gap really clearly between the older and the younger, between the management and the, you know, on the ground. You know, and so for us, as a board, we have, I think, identified wellness as an important going forward tool. But any tool has to be applied correctly, and I think that's the challenge. How do you shrink the gap so that when we both say we want wellness, we both know what each other is talking about?
Mhm.
Because I heard you say clearly, Gloria, you know, I can't make you walk around the block. If you want to be more healthy, then walk around the darn block yourself. You know what I'm saying? But what are the tools that need to be developed for specifically within nursing organizations to help shrink that gap so that the efforts, when public health puts wellness in their strategic plan, you know, it doesn't help to write the words. It helps if it increases the wellness of the organization. I think it's it's not totally new. That Martin survey used the workforce survey, a subset, and they found that all these problems were there before the pandemic. The pandemic just, you know, kind of made it obvious.
Yes,
They
I
would-
agree with that one, yeah. Yep.
Just put the pressure on. But how do we, how are any of you on the wellness? I think isn't there a subcommittee that's wellness as related to recruitment and retention?
Yeah, we met today, in
Yeah.
fact.
Yeah,
Yeah,
what
they're all there.
kind of conversations are happening there?
Hard ones.
Yeah, yeah.
Like the conversation we had today was about, we were kind of like moving through the nursing staffing think tank recommendations, and you know, one of the conversations we had today was talking about, well, how do we, oh, what was the subject, Bree? We were talking about two lists of things, and how do we help improve compensation, total compensation, as a statewide initiative, right? And so kind of we had to get away from conversation about, oh, we have to raise salaries, because that's not a statewide initiative. But what do we have to do to support nurses' perception that they're getting more, like, as it turns out, financial value out of their jobs per the recommendation? And you know, like, we're spitballing ideas around with no real idea that A, we can implement them, B, we have the resources to do it, or C, for that matter, that it's going to work, right? So all we can do, I think, is what, in my personal opinion, is we have right now an abundance of evidence to suggest that we have problems to solve, and zero compelling evidence for where those problems, what the solutions of those problems are likely to be. So that is a terrible situation to be in. So I think a lot of it is a matter of experimentation. I mean, Linda and Bree were both at that meeting too, and so they can you can provide a different interpretation than I might have had, but
Yeah, I think so. I think some of those topics, like engagement, for instance, which was another one that we started that meeting out with, is a significantly easier can of worms to tackle when you think about doing it on a larger statewide scale than total compensation. You know, ultimately, I think education programs are probably going to be the only thing that you can do, but there were some good ideas, and I'm interested to see in the next couple of meetings what people will land on after they've had a little bit of time to think about potential solutions that are actually achievable or measurable, being most important.
We were talking about the community being more, needing to be educated to be more supportive of the nursing community. because of the feelings that that nurses were left out in the cold during, especially at the beginning of the pandemic, and weren't protected as they expected to be. And so there's a whole lot of things there, like childcare and elder care and those kinds of work things that interfere with, or life things that interfere with your work all the time. Free dry cleaning for nurses and those kinds of things that. But I think that one of the themes that goes through all of this is that I'm hearing that nurses need opportunities to voice their concerns and to work with stakeholders to make change happen. And they're frustrated that they're not being heard and don't have the ability or don't have the power to make the changes that need to happen, or at least to feel that they are contributing to change happening in order to make the workplace better for them and for their patients.
So I'm really interested in, Carrie, like your workforce, that open-ended question, what it's going to come out to. I think even that is going to be very global topics as well. But recently we had Press Ganey come out to our organization and talk about the balance, right? And they talked about how I'm hearing that it's really about not really the ethics, but we just value different things, right? Different generation value different things, and just calling it, saying that our work ethic is different, it might be misleading. And some of the terminologies that we're using, it might be also having an impact. Like personally for me, when people keep on talking about work-life balance, I'm fine with my values, but it's like now I have to put myself into this like concrete mold of work-life balance. If I'm not meeting it, then I'm doing something wrong. And I'm like, that's not me. And I feel like sometimes what we teach people might be causing more detriment in some way too, because it's not really the right thing to teach. But sometimes, we help people with the wording and figuring out the labeling of stuff. Like, for example, we discussed moral distress like 8 years ago in our ICU. And once we started talking about it and wellness and self-care, people were recognizing things and then taking action. And then people were leaving the ICU, and we're like, oh no, what happened? We wanted them to self-care. But it's a good thing for them that there is a transfer, but something that we don't want. So I think it's just one of those like balance measure that we need to understand that we are going to cause that shift from discussing it, and we should be okay with it. And the other part is when the Press Ganey came, they said theoretically we all agree, nod our heads. Yeah, let people decompress, right? Like the main thing is connect to the values of why you came into nursing, connect to the mission, like connect why. At the same time, you got to help them decompress. We say we do, but we don't. And one example they gave was, how many of you guys are short-staffed sometimes and start calling everybody on people's day off? And then you keep bothering them and bothering them. You're not letting the opportunity for people to decompress. So you say you allow people to have days off, but are we really having strategies for those kind of things? That kind of really made us, I think, a little bit deeper about, yeah, we say we value it, but we don't have like concrete operational things to make those things happen. That kind of made us like wonder, what do we need to do? And the last comment I just wanted to make is compensation does change behaviors. I was able to see it with our certification rates at Queens. We always gave bonuses, and we changed it to hourly differential, and now everybody wants to get certified. They're like, where's my differential? So compensation does change behavior in that way. Sometimes I worry that it's all about the money versus like the actual, like what it stands for. Now that we're going to, pay preceptor differentials, and I just feel like it's opening like big can of worms where we're not going back to the values piece of it. So I always struggle with that. But just some comments. I have no solutions.
One of the things I think is really interesting about what you just said, Rose, is that we acknowledging the difference in our values. And I feel like we're not in these conversations we have in the advisory board and the conversations we have in the well-being, recruitment and retention working group. I don't think we're doing a great job of addressing that reality. For instance, specifically around compensation and the fact that people are motivated by money to go into nursing. Yes, all the nurses in this room are like, you go into nursing because you're a nurse in your soul and it's in the fiber of your being and you want to take care of people. But we live in a place where you have to make like $300,000 a year to live comfortably. And so the expectation that you would go into a profession like teaching, for instance, which is wildly undervalued and vastly undercompensated, and like, I could do that, or I could go to school for the same amount of time and become a nurse. I'm still taking care of people. The environment is different. Maybe I'm an educator in my soul, but nursing is going to pay me more money. And I think it's hard for us when we talk about what you value. I think it's weird. It's a problematic catch-22 we're putting folks in to be like, oh, you don't value nursing. You don't value taking care of people if you value the ability to pay to live in Hawaii. And I think that that's sort of a problematic, you're talking about language, the words we use to describe what is happening in the workforce. I think that that is one of those places where I think we could probably do better. And like, yes, it's important to make money. We acknowledge that. Can we pay you an astronomical amount of money? No, that's not going to happen. Not viable. But we have to figure out a way to talk to people who are actually in it for the money, because that's reality, right? So there's that acknowledgement. The other thing that I thought was really curious is, where I had it written down. I think I'm going to blame Tinder. I'm not going to lie. Like we're talking about work ethic. It's a way of doing your life. I don't think it's about work ethic. I think younger people have a different way of doing life. Everything is temporary. I don't like this video that I'm watching. I'm just going to scroll it by. I don't like this boy's face that is on a dating app. I'm going to swipe left on him. All they're doing is swiping left on things that they don't like. And when you've done this from the time that you're 12 to the time that you're 25, I cannot be surprised that we have 25-year-old Gen Zs in the workforce who are like, I don't like your attitude. I don't like that you call me on my day off. I don't like that you schedule me for nights instead of days. I'm out. Okay, bye. It's easy for us to talk about work ethic and as old fogies or whatever, who are like, that is an indication of work ethic. But I think it's just a way that people go about making decisions about what is important to them. There's a lot of action. Like it's immediate. I don't have to waste time doing that. So I feel like we have to do a better job of talking about the manifestation of values of the younger workforce. Instead of putting our words on it, what are they calling it? Why are they doing it? Understanding their motivation, I think, is important to solving this problem. I don't know how to get there necessarily, but I don't think we can solve this problem without figuring out what words mean to them. So yeah, I think that's a good insight, Rose, personally.
And just one other thing is, like, Arthur, you were talking about the turnover rates. I was surprised that my organization, our turnover rates hasn't been like skyrocketing. It's been kind of like a little steady, right? But still increasing. But I realize it's a little bit different because I think we have a lot of transfers within the organization. So it's our wellness or kind of dissatisfaction. It might not be showing up in the main measure that a lot of the articles talk about in turnover, because it's really the internal turbulence that might have captured that versus like a global turnover rate.
Like changing jobs within the organization you're talking about.
Yep, nurses going from inpatient to ambulatory, coming back, moving different departments. So, but they're just moving around within the organization.
And I wanted to comment too, we were talking about like, the critical thinking, and if I heard Roberta, Gloria correctly, I mean, we do have to keep, at top of mind that the newer nurses, they're novices. I didn't know how to critically think, I'm sure, until I got out and got my feet wet and everything. And so I don't know if we're expecting a lot of them very quickly because we've got a lot going on and, don't have a lot of leeway to let them, kind of figure it out. And if you're under a lot of stress, you don't critically think very well. So that's another factor I don't think that we talk about. And even experienced nurses, if you're under a lot of stress, you know, the critical thinking goes out the window because your fight or flight's activated. And the other comment I wanted to make, you know, similar to Carrie is, you know, I really think nursing, you know, as a profession has been very, very, very dependent on, I'll say women's ability to take on more and more and more. And any other profession, like, you know, I talk to friends and, you know, I'm like, this is what, and they're like, oh my God, I'd have been out of there, you know, 10 years ago, you know, like, what is going on? What happened? You know, what are you being asked to do? And nothing else changes. Your salary doesn't change, your title's not changing, you know, all those things, but it's like, you know, the whole doing more, you know, not even for less, but for the same pay. And it's like, I think we have relied on that for a long time as a profession. And I think, you know, particularly in Hawaii, that's not sustainable for people to do that. So that's why they're asking for more money, I think, when we ask them to do more. And I don't think that's inappropriate, right? If you're there working more hours, then, you know, we should compensate just like everybody else in the working world, right? I just think nursing's not used to talking about that. Okay.
Yeah, you know, they just finished up a strike of the nurse aides, the teletechs, the dietary, and the housekeeping at Maui Memorial. And guess who does a lot of that work? I mean, the RNs are giving baths and transporting patients. Who else can do it? To your point, Catherine, you just end up having to do what has to be done. Well, that's a good discussion. It kind of, I'm going to swap two items on the agenda and first relate to our discussion to our strategic planning for this summer. And Laura's recommendation is that we do not do professional development, but that instead we get a facilitator to go through that long list of accomplishments, that big spreadsheet she made, and start to prioritize it and even start action planning. And then in November, have the facilitator come back so that going into 2024, we have a firm 2-year strategic plan. And you know, I'm sure that wellness stuff is going to come back up. We already have prioritized it, but does that seem like a good use of our time for our strategic planning approach? It's set right now for August 12th.
This
Okay.
question is not directed at me, but it would be helpful to us if that was what you guys did. We need to, well, there's a lot we can do. There's a lot we're being asked to do. And having really clear guidance from the advisory board is always invariably helpful in helping us being able to say to external entities are like, hey, why doesn't the Center for Nursing do this? We can be like, because our advisory board has established this is a strategic priority. And so we're working on this in order to support what people have already determined, or our advisory board hasn't determined we should be doing. So I'll just ask that you guys give the thumbs up on that because it makes our jobs easier or whatever that's worth.
Yeah. And, you know, we all know, you know, as a teacher, I know that if I try to teach my class everything that's known about any given subject, they won't remember nothing and they probably won't learn nothing. So you got to concentrate on really what's essential. So we are in this time and place in history in this state. We'll have a fresh set of data from Carrie and Catherine.
Finish what you were talking about. I just wanted to say something when you're done.
No, that's what I'm saying. I think that I'm agreeing with the recommendation as well.
Right. And I forgot to say this earlier, guys, but we're talking about this new generation, but there's nobody on this board of that generation. So I know Laura said that there's been a lot of applications. So I'm hoping that one of them at least is someone, of the, folks that we're trying to figure out, what's going on so that they can help us. And if there's not one, maybe we go actively recruiting. That way we don't have to guess what's going on.
Yeah.
I own a 22 and a 27-year-old, so I know how they think. Exactly know how
Yeah.
they think.
I appreciate that, Arthur.
Yeah, I totally agree to Catherine's point. I'm wondering if we need to have a lot more listening sessions from our current workforce, especially, with the diversity, is for us to really know where to prioritize. I love the data, but I think there is something missing where we don't really understand fully what's happening to represent all nurses.
Well, and that could be an action plan. Maybe we do a horse and pony show around and really listen, really ask people what they need and how they feel, and try to document those common themes. But we can't do it on every single initiative. So I think, do we agree on this approach for us as a board for strategic planning for the next couple of years, to run through with a professional facilitator through all the accomplishments and prioritize what we should focus on these next 2 years? Can I have a show of hands? All right, super good. And then the last thing on this agenda, I'm going backwards. There's the National Forum of State Work Centers Conference. It's July 11th to 14th in the lovely city of Washington, DC. And Laura has money for one board member to go.
June
11 to 14. So if anyone is interested in going, I mean, I went to one before and it's just fantastic. It's from all around the nation, things people are doing and working on, and they have all kind of breakout groups, and it's just infinitely informative no matter what your role is. So if there was a way that you could break out that time, that would be good. But if you can, June 11 to 14, look at your calendars and shoot off an email to Laura.
Hawaii, ANA's annual membership conference is the same week in the same city. So there's going to be 3 of us from Hawaii ANA there. And
sounds like happy hour to me.
that'd be good. Laura is aware of that too. But maybe there's some way to support some extra hotel rooms, which are horribly expensive in DC.
Reed, you got something?
I do. So really quickly, just a real brief update on where we are with our recruitment, because that was to the advisory board positions, because that was something that we just recently brought up. At this stage in the year, we would expect to have already received some approvals to the GMs for the nominations, and have some kind of idea of where the governor's office was in landing on the approvals for that. We are in the dark. So we know through the grapevine, the people that have applied, we have not received any notification on where they are. We may be in a position, if they don't process all of the paperwork, to be reaching out to those folks who are due to come off the board and ask if they'd be willing to stay on for another year or for a couple of months until such time as those approvals get made. Typically, we would see in our very next meeting, we would be voting during the May meeting for our leadership positions, and we would also be expecting to be welcoming new board members. And that is not exactly where we are at this stage in the game. We'll keep you updated as soon as we hear otherwise, but you may receive an email from Laura asking if you'd be willing to stay on a little while longer until they get it settled.
All right, thanks, Bree. Well, I think we did that. So is there any last comments, any questions? Any good jokes?
No, but Rose, I'm gonna let you know, you put a bug in my brain just now. When we start putting out the reports about the data from that open-ended question, I want to go on tour and present it at listening sessions to the nurses in the facilities. Be like, here's what you guys said in the survey. What did this not capture? What did this miss? And then we fill in the holes that way. I think that would be fun for dissemination and also an opportunity for a listening session. I'm gonna find a way to make my boss make that happen. Thanks for that. Good idea.
Sure.
For nurses outside the facilities.
Everywhere, all the nurses everywhere in all the places. Like I want to go to where, I don't know, ooh, there's nurses down there, right? Like
In the communities.
let's
Sure.
go find them. I want to go to them wherever the heck they are.
Carrie, are you
Everywhere.
going to suggest that Lily Bloom Domingo do community discussion sessions?
No, I'm not going to suggest that at all.
So let me just ask, Bree wants one more bit of input from us. Did you guys like meeting at that place at Kaiwaiwai last time, or do you like somewhere a little more formal to have the strategic planning meeting? Did you like taking off your shoes in that place, or did you like the golf course?
I wasn't there, so sorry, I can provide feedback.
The acoustics were awful. Is probably the big issue. So I like the country club better for that reason.
Yeah,
But I
that
don't
was,
know if we have access to the country club anymore, so that might be a moot point.
We don't, but there are other places we can investigate if you want something more formal.
I don't know if it had anything to do with the formality. It was just the acoustics. It was very hard to hear.
especially for the people who are on Zoom.
Right.
And Honolulu Country Club that you're comparing to?
Where's that golf club we went to?
It's
Oahu country.
Oh,
It's Oahu.
Roberta was going to say
Yeah.
something.
I was going to say, I don't want to be Oahu centric, but if you would like to meet at Chaminade, we have a really nice facility with a smart classroom and easy parking that's free. And I'll just offer that if you don't come up with a better idea.
I like that.
Thank you.
idea. I really like that idea.
yeah. I have to
It's
fly
simple,
anyway.
It works. Yeah.
And their IT department is superb.
Linda's teasing me because my son often does IT for events, but he doesn't work for Chaminade. But Chaminade has great IT too. I think she was teasing me.
Yeah, well, I have been granted sabbatical. So I'm gonna
Wow.
be off work until November 30th.
Wow.
I'm leaving on May 11th and I'm gonna take a long walk, like 500 miles along the Camino de Santiago. So my husband and I are gonna be out of Hawaii from May 11th to probably, it was set August 15th, but now I'm gonna try back for this August 12th.
Wow.
So if you want to talk about wellness, you're going to see the most raucous version of myself you ever did meet upon the completion of this thing.
I'm so looking forward to that. You have no idea.
And so am I. All right, you guys, you're the bomb. It's so important what you're doing. This is really important, and it's really fun to do it with you. Aloha.
Thank you, everyone.
Right.
Thank you. Good
Ann.
night.
Have fun. Stay safe.
And thank you so much. I
Hey,
really
no
appreciate
problem. I punt every day. Okay, see ya. Thanks for helping me get on and all the other things you did today.
it. Okay, wonderful. And we'll talk soon.
All right, bye-bye.
Bye.